development. Today, we continue to report on the activities that happened in the last 24 hours. And in the last 24 hours, we conducted a total of 459 tests. And out of these tests, we recorded 2 new positive cases. These 2 new positive cases were recorded in Chingola, and this involved a couple, 45-year-old man and a 45-year-old woman, who traveled to Dar es Salaam and Nakonde. And they traveled to Dar es Salaam and Nakonde in the last 2 weeks on a business trip, and they came back, and on testing, they tested positive. They are currently admitted to our isolation facility that brings the number of patients on the Copper Belt to 4. Cumulatively, therefore, we've gone to 76. We still remain at 3 deaths, and we still have 30. In fact, we have recorded 2 more discharges, and therefore the number of cases in our facility remains to be 36, while the number of recoveries has moved up to 37. Countrymen and women, we continue to encourage you to stay home and be safe, and there is absolutely no need for any of us to undertake trips to outside our jurisdictions, and this is what is going to culminate in the challenge that we faced on the Copper Belt. Countrymen and women, we continue to emphasize the need for us to stay home and be safe, put on masks, and ensure that we avoid public gatherings. And if you are home, we're not even encouraging you to be visiting your neighbors. We're encouraging you to be home and avoid any gatherings of any sort. Escalate the levels of hygiene, hand washing, and community hygiene, and let us ensure social distancing. Let us also comply with public health authorities as they visit us in our various jurisdictions to do mass screening and testing. Remember, the strategy is we find the cases and isolate them, quarantine them and manage them, remove the possibility of community spread, and that way we're going to stop the epidemic. Therefore, it is surveillance to find cases and isolate them. How do we do this? Mass screening, testing, testing, testing. Therefore, we've scaled up our testing in Lusaka, which is the epicenter, and in Kafue. The positive news for today is that we've recorded 2 discharges, and number 2, out of the mass screening in Kafue and the screening in Lusaka, we did not record any new positive cases. However, we have continued and even upscaled the testing and the screening. Remember that today we were in Emersdale and Chaisa, and there will be a number of tests that will be done. We'll continue in a targeted manner to test particular parts of the city and ensure that we establish the extent of the disease. Establishing the extent of the disease is fundamental. The numbers of cases is a key metric in establishing the extent of the disease. We have been mounting an adjustable plan, and what informs the next activity is the way the epidemic is evolving. So if you look at the bed capacity that we have today, we have different facilities. At the Levi Mwanawasa Hospital there, the bed capacity is about 800. And so far we're only using the first portion with 100 beds. And we do have, even another facility, where we've placed about 200 beds in case of a flare-up. We have capacity in all the provinces to accommodate patients should we have cases in those places. We have a 200-bed capacity in Masaiti, in Ndola. We also have in Kalindawalo, in Petauke. Does that bring you closer to home?
Yes, it does.
Yeah, Petauke, Kalindawalo General Hospital, a specialist hospital where we have state-of-the-art equipment and well-trained human capital, where we can accommodate between 200 and 300 patients, up to 300 patients. We also have Chinsali General Hospital, where we can again accommodate up to 300 patients. the certain portions of the Ndola Teaching Hospital, certain portions of Livingstone Central Hospital are ready to manage cases. So countrywide, we have adequate bed space. What's our projection? I must tell you clearly that getting into the cold season with the flu season, that would complicate the outbreak. So this is the reason why you and I are summoned to the best of our behavior to ensure social distancing and staying home and being safe and ensuring that we maintain levels of hygiene. In a nutshell, adhering to the presidential directives so that in no time we can establish the extent of the disease, stop community spread, and ensure that the epidemic surges to the peak and quickly plateaus and starts tapering before we get into the real cold season. So the onus is on us to ensure that we all take personal responsibility to ensure, to adhere to the directives that His Excellency President Lungu has given.